Today we are going to discuss the two major artery and veins of the lower limb. So whatever you are going to get in the lower limb, in the content of the femoral triangle you have come across, that is the femoral artery, femoral vein. These are the great vessels of the lower limb. In this we are going to deal the most important one, that is the femoral artery. So in this femoral artery, when you see the beginning of the femoral artery, how it is extended, what is the relations and what is the branches. So we are going to discuss the femoral artery first, then we are going to follow the femoral vein also. So when you study the femoral triangle, major contents we are going to get are the femoral artery, femoral vein and femoral nerve. And today I am going to teach you that is the femoral artery. This can be asked as a long question in the short notes also. So you should be able to write the diagram drawing. This femoral triangle diagram I told you to this you can apply for the inguinal ligament, femoral artery, femoral vein, femoral nerve, sartorius, adductor longus. So this one diagram you can draw for these 7 to 8 topics. So that is very important. So today we are going to discuss the femoral artery as we have come across this structure in the content of the femoral triangle. So that here femoral artery we are going to discuss the introduction of the femoral artery. Second one we are going to get the what is the origin of this artery. Then third we are going to what is the femoral artery extents and the course of the femoral artery. Then relations of the femoral artery. Then we are going to deal the branches of the femoral artery. Then lastly clinical anatomy. So introduction, origin, then extent and course, relations in the femoral triangle and adductor canal. Then we are going to deal about the next part which comes about that is the branches. Then you have to explain the applied anatomy. So these are the very important things you have to discuss. Any vessel or any artery vein you have to discuss under these heads. It is one of the chief artery. It is the main artery of the lower limb. Even though it is developmentally, it is not developed from the axis artery. Inferior gluteal artery is the main axis artery in the upper part of the lower limb. So, but femoral artery is one of the chief artery in the lower limb. So that is in the introduction you have to explain. And this femoral artery, first it running its course in the femoral triangle, then in the adductor canal. That is all about the introduction of the femoral artery. Next going to the, what is the origin of the femoral artery. So when you go to the femoral artery, this is a continuation of the external iliac artery behind the inguinal ligament. You are going to get external iliac artery which will be passing behind the inguinal ligament. At the inguinal midpoint of the inguinal ligament, it will continue as a femoral artery. So, what is the origin of the femoral artery? Femoral artery is originates or continuation of the external iliac artery behind the inguinal ligament. You have to tell behind the inguinal, below the inguinal ligament, no. At the midpoint of the inguinal ligament. So this is the origin which will be originating as a continuation, not the branch. It is a continuation of the external iliac artery behind the inguinal ligament, that is the mid-inguinal point. It will continue as a femoral artery. Then at the end of the adductor canal, it will continue as a popliteal artery. Below it will be continued as a popliteal artery. That is a very important you have to remember. So this is the origin. Then going to the what is the course and extent of the femoral artery. I have told here the femoral artery it begins as a continuation of the external iliac artery behind the midpoint of the inguinal ligament. One, it runs its course downwards and medially. It is not going laterally. It runs its course. When you see the femoral triangle in this, femoral artery runs directed downwards and medially. It is very important direction. Directed downwards and medially, you are going to get first runs its course in the femoral triangle, then it will be entered into the adductor canal. That is the one you have to remember. Then third point, it will below continues as that is a popliteal artery. So that course of the femoral artery, first it is runs its course in the femoral triangle and adductor canal. Then below it will be continuing as a popliteal artery. That is the one thing you have to remember in this. So that we have studied the femoral triangle, then adductor canal. Then I am dealing this is a femoral artery. So that is very important you have to remember. So you understood the point of the course and extent of the femoral artery. So how I have told the extent, it extends from the mid-inguinal point to the at the lower end of the adductor canal. Below it will be continuous as we are going to get the popliteal artery. Then it runs downwards and medially it is running course, and it lies lateral to the femoral vein in the upper part. That is the one you have to remember. Then I have told in the extent mid-inguinal point to the, that is a continuous as a popliteal artery at the level of the lower end of the adductor canal. That you have to remember. Means exactly you are going to get the here tendinous opening of the adductor magnus is there. This will be continuous as a popliteal artery. Femoral artery continues as a popliteal artery. So you have to remember external iliac artery, femoral artery and popliteal artery. So this is the one which is you have to remember about the course and extent of the femoral artery. So next, going to the relations of the femoral artery, you come across in the femoral triangle, you have come across the relations anteriorly and posterior, medial, lateral. Same you have to apply here. So femoral artery relates to the anteriorly. Now I am talking about the relations of the femoral artery. So femoral artery relates anteriorly, skin, superficial fascia and deep fascia. We are going to get the superficial inguinal lymph nodes. Then femoral branch of genitofemoral nerve and medial circumflex femoral vein. Then we have the anterior part or the anterior wall of the femoral sheath. These all are the relations, anterior relations of the femoral artery. Just you have to apply roof structure of the femoral triangle. So whatever you are going to get here is the skin, superficial fascia, superficial inguinal lymph nodes, and we have femoral branch of genitofemoral nerve, then anterior wall of the femoral sheath, that is you have to explain here, and medial circumflex femoral vein you are going to get. Then all these are the anterior relations of the femoral artery in the femoral triangle. Now we can divide the topic relations of the femoral artery in the femoral triangle. Then we are going to the adductor canal. So first one, which is you have to study the anterior relations of the femoral artery in the femoral triangle. And posteriorly, whatever the floor forming structure of the femoral triangle. The floor forming muscles which are there here, psoas major, pectineus and adductor longus. This is the adductor longus. We have the psoas major and pectineus. Here iliacus comes floor forming, that is not relates to the femoral artery. Only remaining psoas major, pectineus and adductor longus. So these are the posterior relations of the femoral artery. Medial related to the femoral vein and its branches, tributaries. We have the laterally by the femoral nerve. So femoral artery related medially to the femoral vein, laterally it is related to the femoral nerve. So these are the relations of the femoral artery in the femoral triangle. So this is just if you study the fix of all the structure of the femoral triangle, roof and floor, then only you can easily apply these to the relations of the femoral artery. Then when you go to the adductor canal, this is the one thigh which were divided into upper 1/3, mid 1/3 and lower 1/3. As femur explained, or thigh is divided for the demonstration. That is upper 1/3, mid 1/3, lower 1/3. Upper 1/3 will be the femoral triangle. Mid 1/3 will be the adductor canal. Lower 1/3 which will be continued as a popliteal artery. So now you know the boundaries of the adductor canal. You have to tell now, explain what are the relations of the femoral artery in the adductor canal. We have come across in the adductor canal anteriorly vastus medialis. Related in this region, you are going to get the vastus medialis. Medially we have the sartorius muscle, and posteriorly we have the adductor longus above, adductor magnus below. These boundaries, structures of the adductor canal, they will make the relations of the femoral artery of the adductor canal. So femoral artery, when it is there in the adductor canal, you have to explain, just apply the femoral artery relations with the boundary structure of the adductor canal. That is the only one you have to remember. So how you are going to tell relations of the femoral artery in the adductor canal. So in the adductor canal you are going to get that is related to the anteriorly vastus medialis, medially sartorius, then posteriorly adductor longus and adductor magnus. That is about the relations of the femoral artery in the femoral triangle and adductor canal. This is a simple way. When you study perfectly femoral triangle and adductor canal, just you have to apply here when you describe the femoral artery. Then going to the branches of the femoral artery. Here we are going to get the femoral artery branches in the femoral triangle. Femoral artery gives many branches in the femoral triangle and many branches in the, that is the adductor canal. So that here I have told in the femoral triangle we are going to get femoral artery gives 3 superficial and 3 deep branches. You can see here 3 superficial branches. One is superficial circumflex iliac artery. Then we are going to get the superficial epigastric artery and superficial external poduntal artery. So these are the 3 superficial branches of the femoral artery. Very important, you have to remember this, because these are the 3 superficial circumflex iliac, superficial epigastric and superficial external poduntal artery. So these are the 3 superficial branches. Again we have the femoral artery itself, it gives the 3 deep branches in the femoral triangle. You have 2 deep external poduntal. One you have the profunda femoris. This is the profunda femoris artery and deep external poduntal artery, and we have the muscular artery. So you are going to get very small branches which are muscular, and large branch of the femoral artery, that is the profunda femoris artery, deep branch and larger branch in the deeper side, that is the profunda femoris, and we have the deep external poduntal. So you should able to write the 3 superficial and 3 deep branches of the femoral artery in the femoral triangle. So question will be asked as what are the branches given by the femoral artery in the femoral triangle? One, it gives 3 superficial, 3 deep. Second one, what are the branches given by the total femoral artery? That you have to add branches in the femoral triangle and adductor canal. So one artery which is we come across in the content of the adductor canal, and I have specifically told in the discussion of the adductor canal, the last branch of femoral artery is the descending genicular artery. The question may be asked, which is the last branch of the femoral artery? You have to explain that is the descending genicular artery is the last branch in the adductor canal given by the femoral artery. So this descending genicular artery, it will divide into one is a muscular and one is a saphenous. This is a muscular and this is a saphenous artery. 2. But they are not the branches of femoral artery. But femoral artery branches in the adductor canal is, that is a descending genicular artery and muscular artery. These are the branches given by the femoral artery in the adductor canal. So you should not be confused about the 3 superficial, 3 deep branches of femoral artery in the femoral triangle, and we have the branches of the femoral artery in the adductor canal. So main branch, which is you are going to get last branch, descending genicular artery. So this is all about the, you have to remember about the branches of the femoral artery. Next, going to the what is the clinical anatomy of femoral artery. So when there is you want to palpate the femoral artery pulsation, we are going to see the pulsation at the mid-inguinal point. Compress on the mid-inguinal point, you can pulsation of the femoral artery can be felt. First, applied anatomy. You have to apply artery-related clinical anatomy points of the femoral triangle. Artery-related femoral triangle applied anatomy points. Here you have to write. So what I will do first, pulsation of the femoral artery at the felt at the mid-inguinal point. Second one, this femoral artery is a stab wound at the apex of the femoral triangle. Is there stab wound or the deep wound at the apex of the femoral triangle? It may cause the injury or damage or the wound to the, it may cut the femoral artery. That is dangerous because main artery of the lower limb. Third one, we are going to reach the, we can choose, this is a very superficial artery in the femoral triangle. Artery is superficial. Arteries are not superficial in our body, they are the very deep. So in the femoral triangle, the artery is very superficial. So that we can use this femoral artery for the ligation or the cannulation. So we can reach from the femoral artery to the, we can go to the heart. Cannulation can be passed from the femoral artery to the, we are may reaching to the heart also through this femoral artery. So how? Femoral artery, external iliac, then we are going to get common iliac, abdominal aorta, and directly we are going to the that is the arch of aorta and aorta. Directly we are entering into the left ventricle because left ventricle arises in the aorta. When you go to the, that I will explain. So 3 points you have to remember in the clinical anatomy of the femoral artery. What I have told was pulsation of the femoral artery felt at the mid-inguinal point. Second one, I have told the stab wound at the apex of the femoral triangle. It may damage the femoral artery. Then as the femoral artery is a superficial one in the femoral triangle, it can be ligated or it can be used for the cannulation. So this is all 3 points you are write in the, that is a clinical anatomy of the femoral artery. So we have come across the part which is, you have to remember, femoral artery. What is the introduction of the femoral artery? Second, I have told the origin of the femoral artery. Then course and extent of the artery. You have to remember, when you see this artery and vein in this diagram, relation, we can very easily relations you can see. The femoral artery medial, that is lateral to the vein. This femoral artery is lateral to the vein. Vein is medial, that is a fix. But when it comes to the adductor canal, artery is in front of the vein. Then when you go to the, in the adductor canal, lower part of the adductor canal, the whatever the you have the, that is a laterally is vein. You are going to get here laterally vein, medially is a, you are going to get artery. Means see it is crossing. So that relation very important, you have to remember artery and femoral vein relation. In the upper part of the femoral triangle, in the apex, at the apex and at the lower part of the adductor canal. It coming medial, vein is coming at the from medial to the lateral till the end of the adductor canal. And in the apex below, it is lying behind the artery. Vein, femoral vein lies behind the artery. This relations is very important in the femoral artery. So after that, I have told the relations of the femoral artery in the femoral triangle, then relations of the femoral artery in the adductor canal I have told. Just you have to apply the femoral triangle structures, roof and floor, and boundary structures of the, you have to apply of the adductor canal. Then I have told the branches of the femoral artery, superficial and deep branches in the femoral triangle, and branches of the femoral artery in the adductor canal. Then lastly, I have told the what are the clinical anatomy points of the femoral artery. So this is all about the shortly we have studied the femoral artery. It can be asked for the 5 marks, 10 marks. It is asked many times 10 marks question. That is you have to remember. And you can draw this diagram or you can draw this. So this is the one which is you can remember. Here also when you see the femoral artery, you can draw this specifically artery diagram. So you can mark here is the femoral artery in the adductor canal. So I have told femur is divided into, or thigh is divided into upper 1/3, mid 1/3, lower 1/3. In this you can see continues as the popliteal artery at the adductor hiatus. Tendinous opening of the adductor hiatus. Adductor magnus opens here, tendon opening, that we call as an adductor hiatus. So this is the one diagram. Separately you can practice for the femoral artery. So I have told here midpoint of the inguinal ligament. And this is the external iliac artery, femoral artery. This is the course of the femoral artery in the femoral triangle. And this is the part where the femoral artery in the adductor canal. Lower part, which is we are going to get, that is the one which is the popliteal artery. So this is the one diagram you can practice. And even you can make the surface marking points of the femoral arteries. Mid-inguinal point, first point. Second one is the adductor tubercle. We can draw this adductor canal. So this is a diagram which is there in the, here also you can see the relations of the femoral artery in the adductor canal. You have medially vastus medialis and anteriorly vastus medialis, medially sartorius, posteriorly adductor longus. This is the femoral artery. So you have to remember about the relations. Then I have to show you the femoral artery, external iliac, femoral artery, here continues as a popliteal artery. This popliteal artery in the leg at the level of the tibial tuberosity, it divides into anterior tibial and posterior tibial artery. Anterior tibial will again continues as a, that is a, we have the dorsalis pedis artery. So this is the one which is you are going to see the course. Then we have to explain the what are the branches diagram you can mention here. Then lastly you can see the what are the surface marking points of the femoral artery. Mid-inguinal point, first point, inguinal ligament you have to draw first, pubic tubercle to the anterior superior iliac spine joining midpoint, mid-inguinal point, first point, second one is the adductor tubercle. Line joining this, you have to, that is the represents the femoral artery surface marking. So in this you can divide the into three parts, upper 1/3, mid 1/3, lower 1/3. Then you have to tell upper 1/3 femoral artery in the femoral triangle, mid 1/3 femoral artery in the adductor canal, and lower 1/3 is a continuous, we are going to get the popliteal artery. So this is all about the topic will be the femoral artery and femoral vein. Detailed study of this including its introduction, origin of the artery I have told, then that is a course and the extent I have told. Then I have told relations of the femoral artery in the femoral triangle, adductor canal, branches of the femoral artery in the femoral triangle and adductor canal. Then lastly clinical anatomy. Included artery is commonly asked for the short notes and 10 marks question, long question also it may ask. So you should be able to write and you can draw this diagram or you can draw this diagram. This diagram represents the femoral artery. So this is all about today's my topic, femoral artery. Write down.